Ja, perfekt. Du musst einfach nur den Internet-Dings machen.
Mhm.
Dann muss es gehen.
Moderation, Entschuldige. Erst Moderation oder fängt sie schon mit der Präsentation an?
Ein Handy ist am Boden gefallen.
Müssen wir noch was einschalten bei den Mikrofonen?
Auf den Knopf, den haben wir.
So, I hope you enjoyed the afternoon and the hands-on sessions. And now we will hear a short repetition, and you will do a Sono quiz with our two former Sono for You tutors, Johanna and Martin. Enjoy and please welcome Martin and Johanna.
So, hello. It's really an honor to do this repetition and the Sono for You quiz for you. I know this is the last lecture. There were 2.5 days full of lectures and hands-on session, and probably the Papillary light. Yesterday was a bit long, but no fear, this won't be a lecture. It will be more interactive. This is my colleague Johanna Strasser. I'm Martin Eberhart. We're former Sono for You tutors or members here. And no, this is interactive. Yeah.
Okay, so we provided for you a short quiz where you can vote on feedbacker. Please just either scan this QR code or you can also type in the source. And the code for this session is just Sono for You. Everything that you voted will be, you can see that on your phone or you can see it on the screens too. And yeah. Has everybody scanned the QR code? Somebody not? Just raise your hand if you haven't. Yeah, okay. Okay, just one moment more. Okay, you still haven't? Okay, fine. So now everybody should be fine, I guess.
So let's start with eFast. All of you have.
Okay, so that.
If the QR code doesn't work, probably try the URL.
Maybe you could show the QR code or the presentation one moment more on the screens so that they can scan it on the screens too. Or maybe you could shortly raise your hand if you're in. Okay, that looks quite good. Not everybody, but almost. Somebody not in? Okay, looks good.
So we start with eFast. All of you, thank you. All of you have tried all of those views, and you tried them now. We'll do a short repetition. Okay. This is the first structure. Please have a look at this first ultrasound clip. What do you think? Is it the Morrison pouch? Is it the collar pouch? Is it the left kidney? Or is it the spleen? Please vote. I'll give you a moment. Yeah? Now you should be able to vote. Great. So, I think all of you have voted now. And
wait,
all
there's still 80?
Yeah, 80.
Okay.
And all of you are right. It's the Morrison pouch. And we continue with the next slide. Great. The Morrison pouch is located between the liver and the right kidney in the right upper quadrant. And we continue with the next clip. The next clip is also really familiar to you.
I already clicked it.
Ja, ist glaube ich. Yeah. We wait a moment for the last ones, and I think.
Wait once more. Okay. 77. Looks good.
Yeah, and again, all of you are right. It's the collar pouch. What do we see? We see the collar pouch between the spleen and the kidney. And there's no free fluid. It's just a normal ultrasound clip of the eFast protocol. And now we continue with the pelvis. What's important about the pelvis? The pelvis always has to be done in two planes. Firstly, the transversal plane, and then we continue with a sagittal plane. But what is a bit confusing about the pelvis, where would we expect the fluid? Because the difference in the male and the female anatomy, we would expect the fluid in the female anatomy between the uterus and the rectum, in the so-called Douglas pouch, or excavatio recto-uterina. And in the male anatomy, it's a bit different, and we would expect the fluid in the so-called Prost pouch, or excavatio rectovesicalis, between the bladder and the rectum. And now we continue with the suboccipital view of the heart. The most superficial structure you're seeing is the liver. And next to the liver is the right heart, existing out of the right ventricle and the right atrium. A bit deeper to that, we see the left heart with left ventricle, left atrium. But where would we expect the free fluid? We would expect it, as we know from physics, at the deepest point. And the deepest point is here around. This is the first section where we expect free fluid in the suboccipital view of the heart. But are we finished with eFast yet? No. What is missing? Missing is the sonography of the pleura. For the sonography of the pleura, you put your probe between two ribs, and between those two ribs, we see the lung. Rib, rib, lung. And now we don't have a close look at the lung, we have a close look at the pleura, at the most superficial structures we are seeing. And we are looking at the parietal pleura and the visceral pleura and hoping that there is some lung sliding. Because if there's lung sliding, there's no pneumothorax. If there's no lung sliding, we expect a pneumothorax. And this was it with the eFast protocol. Now give over to Johanna for the rush repetition.
Yeah, let's shortly repeat RUSH 2. RUSH stands for Rapid Ultrasound for shock and hypotension, and can be divided into 3 parts. We, tutors of Sono for You, use this division into 3 parts because it's more easy to remember all the views. The first is called pump, and it's about our heart. So we have views and can check if the pump function of our heart is more or less all right, if there is any pericardial effusion or not, and we can also estimate the sizes of our ventricles, like if they are enlarged or not. In the second category, that's the tank, and it's about our volume level. So we can estimate if there is everything all right with our fluid balance. Therefore, we can look at the Vena Cava, or we can use the eFast, as you've already heard, to see if there is free fluid. And in the third part, we're looking at the pipes. So that's the aorta, and we're looking for pathologies within the aorta, like aneurysms or dissections, or something like that. So on to your next question. Yeah, I guess that is a bit too easy for you now. And you're also really fast, I see, in answering this question. Okay. And yes, it is the heart. Big surprise. But which view can be seen in this heart right now? I guess you'll have that right too. Just some people left. I guess that's the internet. Okay. It is the parasternal long axis. So what do we see in this parasternal long axis? The structure that is nearest to our chest and nearest to our probe is the right ventricle. Everything below that is belonging to our left heart. So we have the left atrium at the bottom of the picture. Then we have the mitral valve connecting the left atrium to the left ventricle. And then the blood is pumped out through the left ventricular outflow tract and the aortic valve into the ascending aorta. Okay, on to our next view. Which view can you see in this picture? Just 1 second. Yeah. Okay. Wow, 100%. That's great. It's the parasternal short axis. Which structures can be seen in this image, in the center of this image? Is it the aortic valve, the tricuspid valve, the mitral valve, and the papillary muscles, or is it the left atrium? "66 people. Mm-hmm. I think we almost got everybody. Okay. You're very good. It's the mitral valve and the papillary muscles. It's two things that's a bit, difficult, but this one, it's moving like a fish mouth. It's two cusps of the mitral valve. And now you're seeing two of the papillary muscles. So again, here is the fish mouth, and now the papillary muscles. Again, our next view. Okay, which view can be seen? Apical for chamber view, parasternal long axis, subxiphoidal for chamber view, or parasternal short axis. Okay. Very good. It's the apical for chamber view. Let's resume what structures can be seen in here. Nearest to our probe is the apex that's formed by the left ventricle. Next to the left ventricle, we've got the right ventricle. At the bottom, we can see the left atrium and the right atrium. And connecting the left atrium to the left ventricle is the mitral valve. And connecting the right atrium to the right ventricle is the tricuspid valve. Almost done with the repetition, but which part of Rush is shown below? Is it the heart, or one of the heart views, or is it a view of the inferior vena cava mostly, or is it the aorta? I think the quality is not so fine, so it's a bit, yeah.
It's a bit bright around here.
Maybe you up there could show the PowerPoint again on the screen. Maybe if it's not too bad.
But I think most already voted.
Okay, then. Yeah, that was difficult. But I'm sure you would have had it if everything was fine with Victor. So this is the inferior vena cava. And you can see it now on the screens too, so there the intensity is a bit better. And there we have this little small finger, that's a hepatic vein moving into the vena cava. And together they are ending in the right atrium. Okay, so now maybe this is a bit better than before. Again, which view can be seen in this image? Is it a longitudinal view of the aorta, of the vena cava, or of the carotid artery? Or is it a transversal view of aorta and vena cava? Okay, you're almost finished, I see. Perfect. So, it is a longitudinal view of the aorta. We're seeing the abdominal aorta right here. Then, as the left side of this picture is located more cranially, we are seeing the celiac trunk. And a bit more caudally is the superior mesenteric artery. Okay, so let's get to our first case. Repetition finished.
Our first case starts with this picture. You are a student in your final year and have a day shift. It's Sunday at a smaller hospital in the countryside, and they call you because there's a new patient in the emergency room. You don't know what happened, but this is what happened. Doesn't look fine. And you've got a 29-year-old patient. He's male. He had an accident with the road bike. He fell on the ground and another cyclist rode in his right hemithorax. So you see his vitals. He has a hypertension. He's tachycardic. His oxygen saturation is low, and his respiratory rate is higher than normal. In the clinical investigation, you find a hematoma in the right hemithorax, and further you talk with him and you find strong pain and mild dyspnea. But now comes one of the hardest questions: what are you doing now? So
I already started.
yeah. Ask about his insurance number, ask who won the race, or explain to the cyclist manager that he won't race today, or will you bring the ultrasound machine next to the patient? I'm not sure what is the right answer. Okay, my phone is a bit slow.
We have 67, 68, 69.
I think
almost finished.
Almost finished. And
Okay, right now I'm finishing it.
okay, we've got three cyclists in this room, but most of you will bring the ultrasound machine next to the patient. But what to do with the ultrasound machine? Which protocol would you start? Is it rush? Is it fast? Is it e-fast? Or do we have to talk with the head of the radiology department because he's the only one who knows how the ultrasound machine works? Please give your vote. I think this is, again, not so hard.
Yep, and we're almost finished yet, so be
Fast.
right there in a second.
Great.
Yeah.
No. Yeah, of course we start the e-fast protocol. And then you start with the sonography of the pleura. On the one hand, the left pleura and the right pleura. Please have a close look between those two ribs and the pleura here and here. What do you see? Is it lung sliding or is it not lung sliding? Keep that in mind, because your consultant arrives and asks you, was the lung sliding on the one side or on the right side? Or was there no lung sliding at all? So please again vote, and
Maybe you could show it again while they are voting.
Is it lung sliding or is it not lung sliding? Almost all have done the voting. And there is lung sliding left and right. Mostly of you are right. But after you have seen there's lung sliding, you continue with the abdomen. And in the right upper quadrant, you see this. Probably for the better images, look at the smaller ones. What do you see here? Do you see a liver injury? Do you see nothing at all? Is everything all right? Do you see free fluid in the Morrison pouch? Or is there a hemothorax on the right side? Please vote. Give it a try. It doesn't matter if it's not right, but give your best.
And take your time. It's we don't have stress here, so take your time for looking. So I guess almost everybody has looked because there are already 73 votes, 75. Okay, I think we're finished now.
The right answer is there's a right hemithorax. You see a pleural effusion on the right side. Here is anechoic fluid. Here's the liver, here's the Morrison pouch, here's the kidney. There's no free fluid, but here do you see free fluid. And what is specific about this picture or about this clip, it is the spine sign. Always, if you are looking for pleural effusion, you have to increase the depth to see the spine or not the spine. If there's a pleural effusion, you will see the spine. If there's no pleural effusion, if there's normal lung above the diaphragm, you don't see the spine. This is called the spine sign. And yeah, great. We will continue with the next case.
Yeah, imagine you're at the emergency room again, and your next patient is a 70-year-old lady. She's complaining about breathing problems since 5 hours. They started very acute and aggravated quickly. Of course, the first thing you do is measuring her vitals, and you see that she has very low blood pressure with 100 to 73 millimeters of mercury, and her heart rate is quite elevated with 119 beats per minute. Your oxygen saturation with 86% on room air while already receiving oxygen supplementation is quite low. Yeah, you ask for her past medical history. She has no chronic diseases. Nevertheless, 8 days ago, she sprained her left ankle and wears a leg splint since then. And yeah, she's not moving much, lying in bed most of the day. Yeah, taking into account that the onset was acute, there was a rapid aggravation, and her vital signs are not that good, which ultrasound protocol could be useful in this case? All right, you're answering pretty fast. I guess that's not too difficult for you. Yes, it's Rush. Almost 90% of you said that, and it's correct. Okay, so you're getting three images, sorry. We have the parasternal long axis, the parasternal short axis, and the apical for chamber view. Maybe on the screens they're better again, so yeah. Take your time, look at them closely, and yeah, vote. It's now a question where you can vote more than one answer. I guess if we corrected it. Wait, let me check a minute.
Oh.
No. Is it the wrong? It's the wrong. Yeah.
It's the wrong question. Sorry.
Okay. No problem. Don't vote. So. Ein Fehler ist aufgetreten. Okay. We will wait. Okay, I'm sorry, this question doesn't work. But I'm sure that you would have said D sign and enlarged right ventricle, right? We will shortly discuss this. So this is the first picture that you saw. And this is the enlarged right ventricle. In a physiological setting, we're speaking of the 1:1:1 rule. So the right ventricle, the ascending aorta, and the left atrium are appear more or less the same size in this view. And we can see that this is clearly not the case in our patient here. The second picture we saw is the parasternal short axis. And this is the physiological setting. So normally we would have a round ventricle and a C-shaped right ventricle. And in our patient, we have a left ventricle that is in the shape of the letter D, and we have a really big right ventricle. And yeah, okay, maybe now, yeah, and the third, oh yeah, I didn't get the third in, but you saw it here. It's apical for chamber view, and we can see that the right ventricle is bigger than the left ventricle, and that the cardiac septum is curved to the side of the left ventricle. Okay, so let's get to the next view that you're getting from your patient. Let me see if... Could you start a question?
Yes.
Okay, fine.
You already started it.
Oh. Sorry. Okay, that was very clumsy, but okay. Okay, now that you already knew, we see the Vena cava. The Vena cava is really big, and there is no respiratory modulation. And we see the hepatic veins that are also like really big. Okay, so let's now shortly repeat this. We found an enlarged right ventricle, we found the D sign, and we found an enlarged inferior vena cava. What do you think that these findings indicate?
Please be aware that there are more than one correct answer. There are two correct answers.
Okay. Just a bit more time. Okay, 74. Okay, fine. Yeah, very good. I see you've learned a lot in this summer school. We have a dysfunction of the right side of the heart, and we have an elevated pressure within the right heart, and the heart cannot handle it. So that's why the vena cava is enlarged. What are possible causes now for this raised pressure within the heart? Is it maybe, or just like generally, okay? There are 3 correct. Can an acute pulmonary embolism raise the pressure, or maybe a COPD, or an aortic valve stenosis, or a pulmonary fibrosis? What do you think?
Mm-hmm.
Okay. Yeah. These are the 3 correct answers. An aortic valve stenosis is not primarily raising the pressure in the right heart, but in the left heart. Of course, if it's like really long and is getting back to a right heart, then too, but primarily it's for the left heart. Yeah, you can imagine it like that every pathology that is located hemodynamically behind the right heart is able to raise the pressure within the right ventricle. So this could be a pathology within the heart, like for example with the pulmonary valve. It could be a pathology within the vascular system, like the acute pulmonary embolism. Or it could also be a pathology within the lung, like the COPD or the pulmonary fibrosis. Okay, I thought it would be a fun fact, but it's not a fun fact because it was in the lectures. There is one sign more, it's the McConnell sign. And I will shortly repeat this for you. It's in pulmonary embolism, and there we would need the for chamber view, apical for chamber view, and it's when the apex of the heart is moving freely while the mid-free wall is not moving at all, like in this picture. Yeah, and the good thing about this is that it has 77% sensitivity and 94% specificity for the pulmonary embolism. It's a nice to know thing, I guess. Okay, but let's get back to our case again. Taking into account that she was immobilized and how her clinical presentation was, together with the ultrasound findings, we have a really strong probability for a pulmonary embolism. In this patient, the doctors decided to treat her with thrombolytics immediately, even before doing a CT and angiography, because they had the bedside ultrasound and because of her bad vital signs. But after the patient was hemodynamically stabilized, they made the CT angiography, and this confirmed the suspected diagnosis of pulmonary embolism.
So we will continue with the next case. Next case is a construction worker who falls on the ground. He's brought by the paramedics to the emergency room, and he's 44 years old. He's healthy, and now his vitals are like that. He has hypotension. He is tachycardic. His oxygen saturation is normal, and his respiratory rate is elevated. In the clinical investigation, you find a tender abdomen, and he has really, really strong pain on the abdomen. You immediately start with the EFAS protocol, and you find those views. On the one side, the Morrison pouch in the right upper quadrant, and here the collar pouch in the left upper quadrant. Please have a close look. Is there free fluid? Is there free fluid only in the Morrison pouch, only in the collar pouch, or in both. Now you can vote. Please vote. Probably you can look again at the images. Take your time, have a close look, or ask someone who sits next to you.
Okay, 58 people. I think we should wait a bit more so that everybody has enough time to look at the pictures.
Okay, you're just discussing a lot, but now we're closing the voting, and there is free fluid in both of them. And here's the solution. You see the free fluid in the Morrison pouch here, and in the collar pouch here. Most of you are right, but this is not a reason to stop the eFast. You have to continue, of course. Okay. Yeah. This is the next few. Please vote. What are you seeing?
And
Is
note.
this?
Just note that there are 2 correct answers this time.
Yeah. Is this the bladder? Is there more intra-abdominal fluid? Is this the gallbladder? Or is there a splenic rupture? Okay. Most of you have voted. Take your time, have a look at the clip, and vote.
Numbers shortly climbing to the top.
I think most already voted. Let's close the voting. And the correct answer, this is the bladder, but there's also intra-abdominal fluid here above the bladder. So what is the correct answer for the solution of this short case? There is free fluid in the left upper quadrant, in the right upper quadrant, and in the pelvis. So the patient will get the CT, or if he is hemodynamic unstable, he will go to the operation theater immediately. And now we come to the last case.
Yeah. Last but not least, in this late night, we're having a male patient with 57 years. He's brought to you by the ambulance. And he's telling you about new onset of a really severe, disrupting chest and back pain. His vitals are like you can see here. He has hypertension. He has he's tachycardic and has normal respiratory rates, normal temperature, normal oxygen saturation. He has a long-known hypertension so far, and the ECG that you ordered immediately has no signs of myocardial infarction, and the laboratory values, they are not yet completed. You decide that you don't want to wait for the laboratory values, but want to do eFast. This is, ignore what I said and do what you think that is correct, because I think, just do what you think, what you learned in this summer school and not what I said. I just read the first word that I read, yeah. I think we need a few more seconds. Maybe it's just the internet, but...
I think we can close it.
Okay. Because it was a pitfall, it's not eFast, it's Rush. And yeah, you're getting 3 images, the parasternal long axis, the parasternal short axis, and the apical 4-chamber view. Take a close look, and yeah, it's a bit difficult, maybe. Maybe it's better in the screens. Just take a close look. The question will be, or I'll show you the other pictures as well, because you're also doing pictures of the longitudinal views of the aorta and the vena cava. The aorta is on the left side, and the vena cava is on the right side. And the question that you will have to ask is what the most probable diagnosis is. Just read the answers. You will see them on your screen, and I will show you the pictures again. Okay? So you have the questions on your screen, and these were the cardiac views. Okay, and again the aorta and the vena cava.
Take your time. This is the last question for the day.
Should I show the cardiac views again, or don't you need them anymore? Who is for cardiac views? Okay, a few hands. Okay, I'll show you them again to you. Maybe it's a bit more difficult now, so that not everything is too easy for you. Okay, and once or last time, the aorta and the vena cava. Okay, 60 votes. Somebody not sure yet? Until there are a few more votes, I will show you the cardiac views again. 66.
I
67. Okay.
I think we can close it.
Yeah. It is an acute aortic dissection, and I will show you now where this, where this can be seen. In the red circles, you're seeing the descending aorta in all of the pictures, and you can see in every picture that there is a dissection flap within the aorta. It's mobile, and it's dissecting the aorta into two parts. And also, in this image, you can see the dissection flap here. Maybe it's better in the screens, but this white thing flapping in the aorta is the dissection flap. Okay, very good. I see you learned a lot of things in the summer school. And
in the end, we would like to mention that a lot of sources like videos are free on the web. All of our images are from POCUS Atlas or from Ultrasound of the Week or Core Ultrasound. And also, we from Sono for You have a lot of sources on our website, like the eFast poster or scripts in English and in German. So if you want to learn at home or do at home a repetition, you can use all of those things. These are our sources.
Just if you want to know, you can look at the POCUS Atlas. It's free, and there are lots of videos and cases on there. And also the Core Ultrasound with the Ultrasound of the Week cases. It's really nice. Just take a look. It's worth it. Okay, thanks for your attention.
Thank you.
Okay, thank you very much. Are there any questions? Okay, then we would like to thank you a lot for this nice repetition and this quiz. I think it was very nice as a recap. And we would like to thank you very much for your time.
Thank you.
And
thank you very much.
Thank you. Okay, we will have, there's still some stuff to do. First of all, we would like to ask you that you're evaluating this small repetition from Martin and Johanna on this QR code. Actually, wait, I need to turn this around. Can you scan this? Yeah, and then afterwards I will continue. Ja, Evaluierung machen und dann den Posttest noch. Also es dauert jetzt einfach kurz. Stimmst jetzt einfach mit mir gemeinsam, das passt schon. Ich weiß nicht, wie lange der dauert.
Der ist super schnell zu machen.
Okay, und dann sollen die Posttest, sollen die den dann einfach sich quasi einscannen und nachher machen oder auch jetzt einfach direkt machen? Alles jetzt direkt durchmachen. Okay, and for those who are finished, you remember maybe that you did the pre-test on Friday, and today we are doing the post-test that you can check if you learned something during the weekend. So we also ask you that you're doing the post-test now. We will also show the QR code now.
So, zu guter Letzt würden wir uns noch gern beim Organisationsteam bedanken. Also liebe Esther, lieber Christian, danke, dass ihr da so viel Zeit investiert habt.
Sehr gern.
Danke. Und auch an euch, liebe Moderation, liebe Lolo, lieber Samuel, danke, dass ihr angenommen habt der würdigen Aufgabe und dass das so super funktioniert hat. Danke.
Okay, ich rede jetzt auf Deutsch am Schluss, weil das sind jetzt nur noch organisatorische Sachen. So, sorry if somebody's watching us in the live stream still, I will talk just organisatory stuff anymore. I hope you enjoyed the summer school and that you had also nice live sessions, if you watched us. Okay, also, erstens mal finde ich richtig cool, dass die Summer School so stattgefunden hat. Ihr habt ja jetzt hauptsächlich an euch gegenseitig geübt, deswegen findet jetzt nächste Woche, wie ihr ja schon wisst, die Sono-Visite statt. Da solltet ihr entweder schon die Informationen bekommen haben von euren Tutoren, wenn ihr jetzt die nächsten Tage dran seid, sonst bekommt ihr die noch am wahrscheinlichsten irgendwie über eine WhatsApp-Nachricht oder irgendwie sowas. Ihr habt für morgen, am Montag, steht bei euch im Terminkalender irgendein Termin drinnen von der Summer School. Das ist irgendein Fehler, da habt ihr nichts. Genau, dann, falls ihr auch Teil des Sono for You Teams werden wollt, habt ihr die Chance, euch in der nächsten Zeit jetzt auch als Tutoren zu bewerben. Wir suchen wieder neue Tutoren und Tutorinnen. Allerdings geht es nur, wenn ihr im 2. oder 3. Studienjahr seid. Deswegen tut mir leid für alle, die schon weiter sind. Und schaut da am besten einfach auf unsere Website, auf unseren Instagram-Channel oder auf unsere Facebook-Seite. Da findet ihr die ganzen Informationen. Okay, ja, die Bedankung hat jetzt schon stattgefunden, aber ich wollte trotzdem noch einmal mich bei euch bedanken, dass ihr alle teilgenommen habt, dass ihr durchgehalten habt bis jetzt, dass ihr und natürlich auch ein Applaus an das ganze Team, vor allem auch an die Technik, die trotz der, ja, obwohl es sehr schwierig war, finde ich, dass trotzdem alles gut gemanagt hat. Also einmal Applaus für alle. So, jetzt hoffe ich, dass ich eigentlich alles gesagt habe. Jetzt dürft ihr nochmal evaluieren, weil es so Spaß macht, und zwar nochmal die ganze Summer School. Und das ist voll wichtig, dass ihr das macht, damit wir wissen, was wir besser machen können. Seid bitte ehrlich. Und als Belohnung gibt es danach noch Fotos vom ganzen Wochenende, die ihr hier dann noch sehen könnt. Genau, alles Gute euch. Ich hoffe, es hat euch gefallen und danke.